Greetings from Brain, Spine and Joint Clinic. We are here with the second topic of the neurological rehabilitation series. It is in continuation. For the second topic, we discussed spinal cord injury, that is SCI. So now onwards, we'll be discussing about various complications post SCI. The commonest complication and but yet the most you can say tiring of all, and of course most challenging one is the bed sores or the pressure sores. So what are bed sores? Bed sores, or commonly known as the pressure sores, are the wounds, ulcers that form over the bony prominences over the body. When we sit over those bony prominences, there is formation of the open wounds, the ulcers, commonly called the bed sores or the pressure sores. When the skin is pressed against a surface, be it a chair, a furniture, a wheelchair or a bed, and we are not moving enough, we are not taking the turns to the other side while we are on the bed, there are very strong chances of formation of bed sores. Initially, that there is only a small red colored mark over the skin, and then eventually it darkens up, and since it is only visible in a small centimeter area over the skin, but it is way deep inside the skin towards the bone. It can also affect the bone and cause long-lasting infectious diseases, which can be life-threatening if untreated. Now, how much duration does it need to form a pressure sore? Well, it can start within a speck of 2 hours, and it can take months to recover. It starts from a red tiny spot and can get elaborated deep inside up to the bone and spreading across in large area, which can be of any shape: circular, rectangular, oval or asymmetrical. And it can be highly infectious because there is presence of dead skin, flesh and infectious bacteria in that and around the surrounding of that open wound or ulcer. So while in a normal state, when we are sitting for 2 long hours, or we are for a condition in which we have to sit for prolonged hours, we feel uncomfortable, and then we adjust our posture by moving to and fro or getting up from the surface usually. But this does not happen in the case of person who is having SCI. He or she cannot move on herself or himself or take a turn in the bed, and then it becomes challenging for them to change the position, or it is their inability to change. They cannot change their position themselves. They cannot relieve their pressures themselves, and hence there is highest potential of formation of pressure sores or bed sores in them. Now we'll be talking about in which part these pressure sores are being formed. Pressure sores will or can form in any part where there is undue pressure over the surface, and usually it is through the bony surfaces which get in contact with the lying surface, with the sitting surface, or with the pressures. There is constant pressure of that surface. It can happen in any position. It can be while you are sitting for long hours on the wheelchair, or you are not able to take the turn, or your nursing care is not smart or attentive enough to make you change the position every time. Now, how dangerous these pressure sores or bed sores can be. These bed sores, if developed and not managed carefully, can become large and deep. Once they are large and deep, they can go up to the fascia, and they can go up to the bones, and they can cause highly infectious condition, which may take few thousand rupees to a huge sum of lakhs to get treated. And of course, through the blood, the infection can spread all across the body, and it can be as dangerous as it can lead to death. So the dictum which stands true for this condition is prevent, and prevention is always better than cure. In the next video, we'll be talking about how the pressure sores are formed, which are those areas, and how should we manage the condition. How prevention plays an important role in this. Thank you for watching and stay tuned for the next video.